Welcome to Verified RX, your prescription for success. Brought to you by the Vizient Center for Pharmacy Practice Excellence.
As the Drug Supply Chain Security Act dispenser exemption period winds down, the Vizient Standards implementation team announced an important change to the Vizient GLN management program. The data standards team will inactivate unmanaged GLNs, which will impact pharmacies and other providers who are not currently managing their Vizient assigned GLNs. Joining us today are two experts that are leading that conversation. Carl Henshaw, Senior Director, Data Operations, Enterprise Information and Data Management, and Dawn Burtram, the Lead Analyst, Standards Implementation at Vizient. We'll cover the reasons for this change, key deadlines, and the ongoing support Vizient will provide during the transition. I'm Carolyn Liptak, Pharmacy Executive Director in the Center for Pharmacy Practice Excellence at Vizient, and your program host. Carl, Dawn, welcome to the podcast.
Thank you.
Yeah, thanks for having us.
Both of you are new to the podcast. Tell us a little bit about your backgrounds. Carl, let's start with you.
Carl Henshaw, Senior Director of Data Operations, one of them here at Vizient. My team's responsible for standards as well as for the vendor domain. I've been with Vizient for about 14 years, and my background was mechanical engineering and management information systems. And through a pretty roundabout path, I managed to make my way back to the data side of things, which I absolutely love. Super passionate about standards and really excited to have this as a topic for conversation.
Thanks, Carl. Dawn, what about you?
I've been working with the GLN standards since 2006. I'm a lead analyst in the standards implementation and report to Carl. I also work with other GS1 standards such as the G10s, managing our product database, as well as being involved with the GLN management program.
Thanks, Dawn. That's helpful to know. Let's start with the basics. Dawn, tell us, what exactly is a GLN and what does it mean to be self-managed?
GLN stands for Global Location Number. It's a globally unique 13-digit number used to identify a specific business entity at a specific location or address. Being self-managed means the provider or location owner that's responsible for maintaining that information is participating in the data hub and they're managing that information. It's not being managed by a third party. This gives the provider full control of their data accuracy, any updates, and who can access their hierarchy.
You mentioned the data hub. Can you tell us a little bit more about who creates and maintains GLNs in this data hub? And what can you tell us about the three different GLN products and their compatibility?
Traditionally, GLNs were originally created by participating GPOs, and this included Vizient, just to promote GLN adoption. A set of participating GPOs got together, they enumerated their membership roster, and then we participated in education efforts. This practice stopped in 2016 due to changes surrounding the application that's utilized for GLN management. However, in 2022, the pharmacy wholesalers chose the GLN to meet the needs of the Drug Supply Chain Security Act, or DSCSA. We became re-engaged. In 2022, pharmacy wholesalers started creating GLNs for their customers in preparation of DSCSA. And then in 2023, GS1 actually released two more products that allowed providers to directly participate through GS1. The three different products that exist in the market today are the managed GLNs. These are the ones that were created by the participating GPOs or pharmacy wholesalers. All of these GLNs start off with a 1 and 3 zeros. Even though they are called managed GLNs, this information is not maintained by the GLN creator. They were basically created as a placeholder until we could transition the management to the actual location owner. They are unique to healthcare. So all of the healthcare right now are those GLNs created by wholesalers, and those participating GPOs all start with that 11,000. The two products introduced by GS1 include the Global Company Prefix, or a GCP. This is a company assigned prefix the provider utilizes to assign GLNs their locations. A prefix can vary in length, anywhere from 7 to 12 digits, depending on how many GLNs the organization subscribes to receive through GS1. But that GCP is company specific to that organization that subscribes to it. Then there's also the single purchase GLNs. These are just individually purchased GLNs where the provider has gone directly to GS1. They pay a $30 fee. These GLNs start with a 1200 or 1200, and they're accessed directly through GS1. Each of these products is maintained in a different part of the GS1 data hub, and they require their own type of user access. They are not compatible to be managed and maintained under a single sign-on access. Even though GS1 has made it possible to view multiple GLN products for a single organization, a user cannot manage or maintain that information under a single user sign-on. Because of this reason, Vizient does not participate in assigning duplicated access. So if a provider is already participating through a GS1 product, they're automatically disqualified from participating through Vizient.
Does that make sense in terms of the access that's being granted and where Vizient's strategy is in terms of like limiting it? In some cases, it's similar to how if you have a mother and father who work for different organizations and they each have their own insurance providers, the child can only be covered by one insurance typically. There's been some confusion within healthcare that just because GS1 as the standards organization allows redundant access points in terms of us promoting that as a venue that we support is something that we're shying away from because we're looking down the road and we see it's likely going to create quite a bit of pain points down the road, especially as people move on from the current seat. So maybe not in 2025, but in 2027, 2028, there's probably going to be some issues as organizations try to maintain duplicate access points.
And it has already caused issues for some of our members. They may have engaged with GS1 and got a single purchase GLN, and then they've gone to their wholesalers to have those GLNs transferred to them. And then they wonder why they can't access those wholesaler created GLNs. And that's because they didn't have the appropriate access. Their access was through the single purchase GLN. And even though they can see that wholesaler created GLN, they don't have the access needed to make any changes or even to inactivate it. This led us to the decision that it's easier long-term for the provider if they're participating in one product under a single sign-on.
Yeah, I appreciate that explanation from both of you. That's super helpful. If someone has already accessed GLNs through GS1 directly and they can no longer participate in our program, that doesn't prevent them from obtaining the GLNs that they need. That just means they won't be able to use the GLNs that we enumerated back in 2015-16.
That's correct.
One other question that I get often is, you did a great job explaining the three buckets or the three ways to get a GLN, is that number of GPOs and a number of wholesalers all enumerated GLNs out of that 11,000 bucket. And if a current pharmacy or provider has assigned GLNs that start with an 11, that only tells them that it came out of that bucket. How can they determine who actually enumerated the GLNs that they've been given?
Unfortunately, there's no way for a participant who's not already participating in the data hub to see that information. They would have to engage in a GLN management program if it's available through their GPO, a wholesaler, or contacting GS1 directly. Even though GS1 does have what they call a GLN lookup tool, this tool is limited to only providing the status, name, and address of the GLN that's provided to it. It won't tell an organization or user who holds the current control of that GLN. The only way you can access that information is by having access to the data hub.
Vizient has played a key role in educating and preparing providers for the DSCSA compliance deadline. Tell us a little bit more about how your team has done that.
We have supported the transition to self-managed GLN data through multiple year effort. In 2023, we hosted regular education and training calls. These were biweekly calls for several months. We helped providers understand the GLN standard and how to access the GS1 data hub. In 2024, we transitioned that education and training to an online format. This allowed our customers to access the information 24/7. This is still available today through our GLN learning site, through Vizient's Learning Center. We also started working with the GS1 work group to help resolve duplicate GLNs and just started scrubbing our data for data inconsistencies. We stopped creating GLNs in 2016. So we had to go through our roster and start scrubbing the data, addressing where membership records might have been inactivated or address changes. So all of that information was scrubbed during this period. In 2025, our cleanup efforts have been ongoing. We're shifting our focus to long-term data integrity through new tools and processes. One of the things we want to start building are ways to audit our data so that we can maintain information that's reported to us versus trying to maintain or keep up with information that's not managed.
Dawn, you mentioned inactivating GLNs. What can you tell us about the recent decision to inactivate unmanaged GLNs and why it's essential to maintaining the accuracy and reliability of GLN data?
Inactivating unmanaged GLNs is critical for improving data quality and ensuring industry compliance. One of the things it addresses is outdated data. GLNs not managed by providers often contain inaccurate or stale information. This information was created based on not only the GPO database or customer databases, but also wholesaler information. The reason the GLNs were created were to address these inconsistencies between supply chain partners. So we have to address that outdated data, address duplicate records. Third-party GLNs have led to thousands of duplicate and data conflicts. This is not only between each other, but also within our own databases. GLNs help address that, but that information still has to be addressed by the customer to identify that, yes, these are duplicate locations. And also with GS1 compliance, GS1 introduced new rules that require providers to manage their own data. Historically, GPOs were allowing members to participate through their hierarchies. GS1 changed that rule, I believe it was 2023, where the providers engaged have to sign a user agreement now. So we started transitioning our members to their own GS1 account where they no longer access the same GPO hierarchy. And then provider ownership. Self-management puts control in the provider's hands and reduces supply chain risk. And this initiative supports Vizient's long-term goal of improving trust and accuracy in GLN data across the healthcare industry.
Sounds like this is a lot of work. We know that there are a large number of duplicate GLNs out there. So even though it seems like a lot of work right now, my understanding is that this is all intended to make things less complicated going forward. The goal right now is for everyone to manage their own data, regardless of who enumerated the GLN in the first place.
The goal has always been for member management, provider management. The information needs to be maintained by the location owner to maintain its accuracy.
Okay. Dawn, help us understand a little bit what it means to participate in our program and who is eligible to participate in our program.
Providers who qualify for participation will gain access to our GLN education and recorded training sessions. We've also provided some downloading documentations that are based on the managed GLN program. It's just experience that we have gained over the last 20 years to assist our customers, such as best practice documents, a document explaining how to set up a new user. Customers gain access to that information. They're also provided Data Hub access. GS1 allows us to set up a single user as an administrator for their organization. And then that administrator handles who gains access to their organization's hierarchy through the Data Hub for their entire organization. We also provide a roster audit, which is a comparison between their Vizient roster and the GLN information recorded in the Data Hub, just to give them a starting point to identify what needs to be cleaned up, what GLNs need to be recorded. Now, this audit only covers the GLNs we have recorded. For members participating, we do encourage them to search the Data Hub to see if there are other GLNs created for other locations. And also, the participation through Vizient is at no cost to eligible providers. Some of the high-level eligibility requirements are the customer must be active with a participating Vizient alliance that's currently Vizient, Provista, or CHA. They must be a healthcare provider, and this includes hospital, clinic, or a non-retail pharmacy. If they are considered a wholesaler, solution provider, or manufacturer, they must go through GS1 directly. Also, they cannot currently be participating with a GSM1 product. We only provide access at the system or corporate level. So we don't provide access to like individual hospitals if they are part of a larger organization. It must be at the system level, and then that entity would provide any of their hospitals or locations access. And then also the applicant that's applying as the administrator must have the authority to manage all GLNs across the organization, because the GLN itself is not pharmacy or department specific. It's intended to identify all locations within a healthcare organization.
That makes sense. How can Vizient clients apply for Vizient's program? And what happens if they don't? Most importantly, why does the deadline of November 15th matter so much?
Providers can go to our Learning Center website to access both our GLN education, which gives a more in-depth explanation about what the GLN is, the different products, how they differ, and gives information about our program, what their responsibilities are, what their admin responsibilities are. We encourage all of our providers before they apply to watch this 20-minute education. And also our application is available along with a GLN FAQ, which covers what's covered in the recorded education site. It just gives them more point by point in case the customer wants to see something as a reference. And that's accessed through our GLN learning site, available through Vizient's Learning Center. Or if a provider does not have access to the Learning Center, they can reach out to their SPIN team or to our standards department to get access to that link to the training site and get those documents. For standards, our email address is standards@vizientinc.com.
Thanks, Dawn. We'll be sure to include the link to that email address and the link to those resources in our show notes.
When they apply, we say there's a 5 to 7 day turnaround, but we typically try to get back to customers within 48 hours. If they don't receive a response within 7 days, we do encourage them to reach back out to us to make sure we receive their application. A provider is not yet engaged with managing their own GLNs, they can reach out to that website to apply.
And Dawn, specifically, your team is asking for those applications to be submitted by November 15th of this year in advance of the inactivations that will be starting in January. And that's just to allow enough of a window for all of those steps to take place.
Yeah, because the DS1 Data Hub is not a Vizient application, once a member submits an application, we ask that you give us at least 5 to 7 business days to review the application, get the information together. Once approved, it can take anywhere from 2 to 5 weeks for GS1 to establish the account, transfer any existing GLNs from Vizient to the customer's account, and for the provider to gain access to that. They are working on steps to speed up this process, but right now the turnaround time can be anywhere from 2 to 5 weeks. It's not immediate access. So that's why we have the November 15th deadline. It gives us enough room to not only get any applications we have up until that time reviewed, get GS1 to establish the accounts, get all that transferred before we start our inactivations in Q1 of 2026.
Okay, very good to know. Thank you, Carl and Dawn, for joining us today to share your thoughts and your insights. It's been great chatting with you. Join us for more Verified RX podcasts. Subscribe today. Like us. Send us your comments. We'd love to hear from you. Verified RX is a prescription for success and is brought to you by the Vizient Center for Pharmacy Practice Excellence. Thanks for listening.